The advice and opinions expressed by the host of Autism Live and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice. The Center for Autism and Related Disorders advises working with a board-certified behavior analyst who has experience with autism before starting any intensive behavioral intervention. Any choices you make in determining your child's treatment are completely at your own discretion.
Good morning and welcome to Autism Live. I'm Shannon Penrod and so thrilled to be here with you happy, wonderful, fabulous people. I've been on the phone with all kinds of customer service stuff. We are going to do the customer service 101 class, but I have to learn how to lower my blood pressure first before we can do the class because, COVID has just made that infinitely more fun. Yes, I think so. Anyway, I'm Shannon Penrod. We are coming to you live from my house, and we will come live to you from many different locations around, I think, Southern California this morning. But I'm thrilled to be here with you. And this show is meant to be interactive. So I hope that you're also thrilled to be here because we're going to be looking forward. Our chat is struggling a little bit this morning, at least on my end, Traven. But we're looking forward to hearing from you. So let's talk about how you can interact with the show. Right now, we are live on YouTube, we're live on Twitter, and we're live on Facebook. And on any of those three big platforms, you can be writing into us directly into the chat. It will show up here eventually. I don't know why it's struggling. I have a secondary backup. So if you write in, let's do a test to see if I can actually get your comments right now, because I have the circle of death, Traven. I don't know what that's about. I don't know whether I need to restart something or I don't know why it's not working, but I have it on the secondary. So somebody write in and say good morning and let me see if I can receive messages. But I also want to let you know that we are also live on a bunch of other platforms. You just saw Vaughn Live, D Live. We're on Africa TV. We are live in as many places as we possibly can be. And so I see Anne says hi. Hi, Anne. See, I am getting messages. Okay, good. Thank you for doing that for us. And Kathy says, good morning. Yay, it's working. I love when technology works. So the backup is working. But Traven is showing you now all the places that we podcast to. We are a free download pretty much everywhere you can get your podcast. Please look and see if we're there. If we're not, would you do me a favor and drop us a line and let us know that we're not in a place where you would like to find us? Because we really want to be everywhere that anyone in that larger autism community, if they're looking for information and inspiration, that they can find us. Again, free of charge. So when I say that it's the larger autism community that we're talking about, of course, that starts with individuals who are on the spectrum themselves, have received the diagnosis. They are the beating heart of everything that we do, right? And we never want to overstep their message, their thoughts, their concerns, their questions, right? But I will tell you that on this show, we not only want to elevate their communication to the world, we also want to welcome everyone who loves those individuals. Because I'm in that category. I am not a person with a diagnosis, and I always want to be educated more so that I understand the point of view of those who have a diagnosis. But I am firmly in the camp of someone who loves not just one, but many people on the autism spectrum. And in my life, it is part of my mission in life, but my whole mission here is that I want to help the conversation to get those individuals the rights, the dignity, the employment, the housing, the ability to love who they love, to wear what clothing they want to wear, to help them to get to the things that are meaningful to them. And I know that I'm not alone in this, that there are many of you out there who dearly love someone or a bunch of people on the autism spectrum, and you want to be able to help them to get to the resources and the services that will support them in a way that is meaningful to them. And that's what we're about here. I want to help each and every one of you. It is not a one-size-fits-all community. So please don't make me guess what you need. Please be writing into the chat and let us know what your circumstances are and what you need help with, what's really kicking your keister today. We do have a wonderful guest who's coming up in about 15 minutes that I think you guys are going to find really informative, because we're going to be talking about dentistry. Dentistry for those on the spectrum, because of course, we're not leaving them out of having good dental hygiene and having pain-free experience with, the inside of our mouth, correct? Excuse me. Just saying that, got me all salivating, not in a good way. Going to the dentist can be something that's really traumatic to a lot of us. You don't have to be on the spectrum to have concerns about having people in your mouth with metal instruments, right? Or have people sticking a gloved finger in your mouth, right? It's not what we do on a daily basis. It's a sensory experience, right? But we've got a dentist who's going to be talking with us, and I'm saying hi to Parker and to Tristan, who Parker just told about the show. Thank you for that, Parker, because that's the other thing. We love it when you guys share information. So invite your friends, bring them here. And if you like what you see, we have a little video at the end. Make sure you subscribe or like or review or whatever you do to tell other people that you liked what you saw here. Because we don't have a marketing budget, y'all. We don't have money to spend on that. We count on you to tell people in the community. So anyway, we really, our mission here is to provide information and inspiration to that larger autism community. We hope that you will help us always to steer the conversation. So please write in. Please remember that we have lots of experts, and I've got an expert in dentistry who's going to be with us in just a few minutes. And every day we have different experts. Please don't confuse me with one of the experts. I am a cheerleader. I was going to say a big old cheerleader, because I'm a big woman, and I'm a cheerleader for you and what you need, and I want to be helpful to you. This is the promise that I made when my son was diagnosed on the spectrum, and I didn't know what to do. I said, please help me. Please don't let me mess this up. Please let me be the mom, let me not be the mom who messes this up. Let me be the mom who, helps support my son in a meaningful way. And if you do, I promise I will do what I'm directed to do, and I will turn around and help whoever I can. So here I am. I want to help you. So please write in, and I'll do everything that I can to connect you with experts and resources to help you to do the thing that you want to do. But please don't mistake me for being one of the experts. Yes, I have been hosting shows about autism for over a decade. I don't even know how that decade flew by. Notice that my hair turned white while we were doing this. And the truth is, it was white before I was dyeing it. But don't tell anybody. But in any case, I've been doing this for more than 10 years, interviewing experts. So I like to say that I have an informed opinion, and I'm willing to share my informed opinion, but please don't mistake me for being an expert. Even when I was a little girl, I had one of those voices that made it sound like I knew what I was talking about, but it isn't always the case. It's just strident. So in any case, thrilled that you guys are here. Somebody said the other day, I'm not saying it as much anymore, but I always say to you, we hold hands. We get through this together. Si se puede, right? Yes, that's right. So let's take a look. This is the time of day when we like to do something we fondly refer to as the jargon of the day. This is when we take on one word, one phrase, one acronym. We try to, first of all, we give you the actual definition. Then we make fun of it first, and then we give you a working definition, which sometimes also needs to be made fun of. And then we try to put it into context for you so that you begin to understand. And hear me when I say just begin to understand. Please don't beat yourself up if you don't understand the jargon terms the first time out, because I don't think anybody does. And you can get frustrated with the jargon terms, or you can begin to slowly learn them in the order in which they're helping you. because sometimes somebody will say one of these jargon terms, and instead of just rejecting it and saying, oh my gosh, this is so overwhelming, right? If we take a second to find out what does it mean, we find that often it's the answer to the thing that we've been worried about, concerned about, or saying, isn't there something to be done about this? And that jargon term helps us. So this is why we do this on the show. I'm saying hi to Bish. Bish, how are you? So thrilled that you're here. Okay. So today's jargon term, we kind of, we had been doing the verbal operants, and now we've taken a left-hand turn because on Monday, as we told you, it was officially, we did the ribbon cutting. It is officially IEP season 2021, right? And on Monday, we talked about what an IEP is. So now, today, we got to talk about what a 504 plan is. And I don't know about you, but when I first heard about a 504 plan, I was like, is that the genes? Somebody said, what are you talking? Oh, no, those are 501 genes. I was like, what's the 50? Oh, is that the thing where you donate to your child's, instead of your retirement, you donate to their education plan? No, that's not what that is either. So let's take a look at what a 504 plan are. First of all, our actual definition, a 504 plan is a plan developed to ensure that a child who has a disability is identified under the law and is attending an elementary or secondary educational institution, receives accommodations that will ensure their academic success and access to the learning. And you might be scratching your head and going, okay, I don't, what is the difference between a 504 plan and an IEP? Don't worry, we're going to get there. So this is our actual definition. Nothing to be made fun of here. Pretty serious business, right? So let's take a look at what the definition is of this. A 504 plan allows access and accommodations to education, but not special instruction. There are no goals, and therefore there is no reporting. So that kind of really starts to winnow it down. But one way that I like to think of the difference between an IEP and a 504 is that in an IEP, they're both legally binding, right? But in an IEP, it is under the IDEA, which is the Individuals with Disabilities Education Act. So all of the things, if I have a question about what's allowed or not allowed in an IEP, I want to go back to IDEA and I want to look and see what it allows for. Now, the 504 plan is under the auspices of the Americans with Disabilities Act. So if I have a question about what's happening with the 504, I want to go back to the Americans with Disabilities Act. Now, one of the questions we get all the time is, can a child have both an IEP and a 504? And the truth of the matter is while you could qualify for both, an IEP also includes in it the things that would be in a 504, but it has more. So if your child has a qualifying diagnosis, which autism is a qualifying diagnosis, then they are entitled to an IEP. Now, a lot of schools will say, that's not entirely true, because if we can't prove that there is an educational need for an IEP, then we will just do a 504. Now, I'm going to call malarkey on that. And if that is the argument that you're in with your child's school, it's time to, really pull out some big guns and potentially lawyer up, because these are people who really just don't want to spend money on your kiddo. And I hate to be that like across the board, but the truth of the matter is that you can make a case that if you look at what the strict definition of an autism spectrum disorder is, there's no way that you wouldn't qualify for educational support. And a lot of times what schools do, and I'm a former school teacher, love me some school, right? School is a good thing. I'm not saying school is a bad thing, but they have not fully funded IDEA. Please, President Biden, could you? And he promised he would. So come on now, let's get that all funded. I know you got a few other things on your plate, but this was one of the campaign promises, is that IDEA for the first time would be fully funded. And until it gets fully funded, schools are going to have to find a way to cut short because they don't have the money. So I'm not saying they're bad people, but they're going to try not to pay because they don't have enough money in the coffers. It wasn't fully funded. So they will say this child doesn't have an educational need because they're getting straight A's. Again, former teacher, I can tell you that a child can be getting straight A's but still be struggling. A child can be getting straight A's but being bullied on the playground because they don't understand how to do the social stuff. And IDEA includes that stuff in it, right? Now, there are times when a child does so well that they progress past the need for services. And, they make so much progress that they no longer maybe they need some accommodations. Maybe they need, I'm trying to think of something. Maybe they need preferential seating. Maybe they do better if they sit in the front of the classroom, but they don't need speech anymore. They don't need OT. They are not needing any help with testing. They don't need any pull-out services for anything anymore to be successful. And if that is the case, that is when you can begin to talk about moving from an IEP to a 504, or you can talk about letting it all go. And I want you to know that happens. It doesn't happen every day of the week. And I definitely think that parents need to be very wary. If they start talking, for instance, there are some kids that do great in third grade, and the school will say, I really don't think we need the IEP anymore. And I want to say to you, time out. Because there are going to be some things that come after third grade where you're probably going to want the IEP back. So I would be very wary about getting rid of that IEP until your child is successfully showing that they can do what they need to do in high school. Now, when you go to college doesn't have IEPs, and colleges have a form of a 504, but it is nothing like what we have. So you notice that it said on there that it was for elementary and secondary ed. There is a form of 504 that looks vastly different for college. Your child's 504 doesn't just go, 12th grade, college. It doesn't work like that. So I know Bonnie Yates, who's our special education attorney, that a record that she comes on a weekly basis, whatever possible. She always says, if they try to talk you into going from an IEP to a 504, don't do it. There's not a benefit for you. I don't know if that's entirely true, but I can tell you as a parent, I wouldn't even think about doing it until your child has successfully completed 2 years of high school, because there are always things around the corner. And if your child has successfully completed 2 years of high school and you are 100% sure that you and your child has their transition to their real life under control, don't give up the IEP, because the IEP includes their individual transition plan, their ITP. And once you move to the 504, that doesn't exist anymore. So if you want your child help getting employment skills, you want them help going to college, don't give up your IEP. But a 504 can be very helpful for kids who don't need those extra services. But I got to be honest with you, almost all, I would say 99.99% of our kids on the autism spectrum would be better served by an IEP. And sometimes you have to fight for it. But if you are 100% convinced that they don't need the services, a 504 plan is still actionable, not in the same way that an IEP is, but it comes under an entirely different heading for the 504 plan. So something to consider, these are the differences, but especially if you have younger kids and you're talking to the school district and they start pushing the 504, back that bus up and argue for the IEP. Your child is going to be better served almost always. Okay. Somebody wants to know, what music choir program can autistic children enroll in? The children have difficulty reading and writing, but they have musical talent and can sing. I would check in your, one place that I like to go to that it's not always up to date, but I can find a lot of resources there. If you go, and I know it's not everybody's favorite thing, not looking for controversy here, but if you go to Autism Speaks, I just lost the whole chat, Traven. I don't know what's going on with the chat today. But if you go to Autism Speaks and go to resources and then go to your state, and then you can put in the community and you can put in the zip code and you can say within 20 miles, Then it will give you a printout of just different resources. And you can say, I'm looking for instance, dentists, or you can say, I'm looking for ABA services, or you can say, I'm looking for other kinds of resources, including music programs. I think if you're near a big city, you will find that there are lots of music programs. If you are not near a big city, I think you're going to find much less. But in COVID, a lot of the bigger programs are doing classes online. One of my favorites, Spectrum Laboratories. You can find them, it's Spectrum Laboratory, I think.com, Google it, so you can get the right website, but they are doing music classes online. Yeah, I don't know why, Traven, it is not working for me. So in any case, I don't know what's going on with the chat, but Spectrum Laboratories, great for musical programs. I know the Miracle Project is also doing musical theater programs. There's a program called Jazz Hands. We love them. We've had them on the show before. I think I'm probably forgetting about 32 different programs we've had on. Forgive me for those of you who have music programs. But I would also go to, one of the things I recommend is that people get some sort of a support group that's local. I always like a bigger global one too, but a local one is great for knowing what services are available. For those of you, if you haven't already, go to TACA, which is TACAnow.org, and see if there is a local TACA meeting in your area. A lot of them have not been happening in COVID. They've been happening online. But sometimes what they have and what I subscribe to, because I was on the outskirts of Los Angeles when we were in our early intervention. I was able to subscribe to a newsletter where I had access to a whole bunch of parents in my area. And every day I clicked the daily newsletter, I would see what the chat was, and I could respond, or I could ask a question, and I could say, hey, who's the dentist to go to locally that's really good with our kids, right? Or who cuts hair and is going to be understanding of the fact that when they turn on the clipper, my kid is going to lose his mind and jump out of the chair, right? And you can say, who does music lessons, either included or just for kiddos on the spectrum, that I could do this with. You might find somebody who's got a great drum circle that your kids really respond to. Or you might find somebody who does singing lessons. So definitely check that out. Let me see if the chat, yeah, I missed a couple of your comments because now I have the chat up and running, but it destroyed whatever was there before. So I don't know what that's about. But if you wrote something in after Bish asked about the music, I need you to rewrite it in. I apologize. Okay, so back to our starter of the day. We've done our jargon of the day. Let's move on to our question of the day. We always have a question for you. Okay, so what is our question? Are you confident about your next IEP meeting? And if you are not, I would really love for us to talk about that on Monday, because we didn't have Bonnie. We kind of did. I had said that this entire year, I want to be thinking of our show as part of a last lecture series. That not to say that I'm going anywhere, but I want to make sure that I've said everything that I want to say this year. And Monday ended up being sort of my class on IEPs, how you get ready, how you look at it, how you walk in that door and feel as confident as you possibly can. So if you are not confident about your next IEP meeting, I would like you to check out Monday's show and then write in with questions, because one of my passions is helping caregivers to be prepared for those IEP meetings, because I know what a difference it makes when you walk in the door and you know what you know and you know what you need, and that's it. That's the end of the discussion. They can say whatever they want, and you're going to leave that meeting having said, this is what my kiddo needs. And I have found over the years that that's what gets you the best IEP, which gets you the best year at school. So let's be confident in our next meeting. And we've made that whole resource for you on Monday. It's like the hour class on IEPs. So it's there for you. Let's take a look at what our topic is this week. And you won't be surprised at all, because it's about great IEPs. So many times I got to be honest with you. As a teacher, I attended IEP meetings and totally had no concept of what it was like for parents on the other side. I kind of would like to go back and do those all over again because I just didn't know. I just didn't know what it was like for parents. But I do now. And I really like to talk, having been on both sides of the table with people, to understand that what happens in that meeting has the potential to set a child, a student up for great success for the year. What it doesn't have the potential to do is ruin everything. So, it can be a horrible IEP meeting where nothing gets resolved, and that's horrible, right? But it doesn't mean that the conversation is over. And if things go south in an IEP, we can always, to some degree, fix that, right? It's never overdone. Yes, if we sign, it's harder to amend it, but it's not impossible, right? So really, there's nothing in that meeting that can really destroy things. However, there are things that can happen in that meeting that make the flowers bloom. And that's what I want to get to. And most importantly, I want to empower parents to not be nervous or to dread the IEP. If I said to you, look, I'm gonna send you to a meeting and it has the potential to be the big game changer, I think we'd all get much more excited about it, right? But I know from experience that I used to go to IEP meetings and go, oh no, is this when I'm gonna blow it? Is this when I'm not gonna know some little ticky thing and they're gonna get one over on me, and then it's gonna be that my child failed because of me? That was my mindset, and that's not a good way to go into anything. So definitely check out Mondays, and let's get excited about the IEP season this year. You got more things in your corner this year than ever before, because schools know that they did not. I mean, let's be fair. This was really hard. This was a really hard year for school. And they know that it was not a good year. And, I don't think that we need to blame them. COVID is not their fault. Some schools, though, did a lot better than other schools. Let's be honest. Some people got really creative and proactive and made the distance learning thing happen. And some people went, I don't know what to do, right? In any case, the bottom line is that our kids have a right to learn. We have federal laws that say they have a right to learn. And so we need to hold schools accountable. That doesn't mean we need to get all angry. We don't have to lose sleep over it, right? We're just going to hold them accountable. We're going to keep going to meetings. We're going to keep saying, nope, you got to do that. And the law is on your side. Isn't that the good news? That's the really good news. We have a new administration, and we were made a bunch of promises. I'm hopeful. If IDEA can get fully funded, you guys, I will be dancing in the street. And I will notify you, and we can dance in the street virtually together, because that would be a day that has been supposed to arrive for over 20 years. Wouldn't that be something? So, President Biden, you promised. We're going to hold you accountable, right? Okay. So, having said all of that, I'm so glad that you guys are here. Chat is still struggling along. But, okay, I'm saying hi to Charlene, to Miss Brenda, who said autistic child jumping out of the dentist chair, LOL, but we have somebody who's going to help us with that. And yes, we're getting a lot of links. Very helpful topic. Thank you. Yes. Okay, great. So our guest today, and all of my documents have gone kafooey. I'm going to have her introduce herself, but she's been on the show before, an amazing dentist. She's got books that she has written on this subject, and children's books to help our children to be more successful in the chair. So let's welcome our guest. And because my computer has gone completely kafooey, I need you to completely identify yourself and tell us what your credentials are. Thank you so much.
Hey, Shannon, it's good to see you again.
Good to see you too.
I am a dentist. I've been working with children for the last 20 years, and I have written multiple books for children to help them, get over the fear of dentistry, educate them about the importance of good oral health and making their dental visits easy. So it's been a long ride, but, a fun ride, I would say.
And tell them what your name is, because I don't even have that in front of me because my computer has gone completely crazy.
Well, my name is Humaira, Dr. Humaira Shah. If you've heard about the drug Humira on the TV, that will make it much easier. But everybody,
Okay.
Dr. Shah.
Okay, so wonderful. So let's talk a little bit about what parents need to know right now for everybody who's sitting there at home and they're like, oh, I've got this child or these children on the autism spectrum, and I don't know. Some people, I hate to say this, Dr. Shaw, some people have said, this is just a fight I'm not willing to have because I can't even get my child to brush their teeth. So talk to us a little bit about your point of view as a dentist and what you want us to know for individuals on the spectrum.
So, it's not easy, getting a child to dentist, if your child is on autism spectrum, getting their teeth brushed. It's a little bit of a struggle. I agree with that, but there are ways to make it easy. So first thing first is start early. So nothing is new to them as they are growing up, which would mean like start brushing their teeth when they are babies as soon as the teeth erupt. Then once it's a routine and they're used to it as they are growing up, it's not a new experience. Routine is the most important thing for all kids with special needs. So as soon as you see the tooth come in, start brushing their teeth. That way they're already used to it. They know this is going to happen.
So that's great advice for those of you who have the really small children. It's like, when is a good time to start now? Absolutely. But for anybody who started, who didn't, we didn't have the benefit of you telling them that 4 or 5 years ago. What do you have any tips and tricks for us to be able to make this palatable or even fun now?
Yes, I do. So what I would, lot of kids with autism have sensory issues too. So that makes it even harder. You put the toothbrush in their mouth. It's not like any other child. It's a little harder. So what I would suggest is go see some videos, make it fun for them. There are so many songs. This is how we brush our teeth. They can dance. Autistic kids enjoy visual, music, dance. So while you are helping them brush, get them busy with the video. Another thing is reading. Reading will help them, make them understand why is it important to brush their teeth. I had written Sam and the Sugar Bug, and I actually added narration to it just for the kids with autism. And it was widely accepted by the kids because they could hear it and see it. That version is specifically for the kids with autism. It's available on iBooks. I'll send you the link so you can share. The book is also in hardcover. It's called No Rushing When Brushing. So what it has is it has 2 books in it. One tells them a story why it's important to brush, and another one, what's going to happen at a dentist. So when they go there, it's not that difficult.
Yeah, well, let's talk a little bit about when we start to go to the dentist, because at what age do you recommend that we start taking our kiddos to the dentist?
First birthday is when
Wow.
Yes, that is the key here for every child, not only kids that are on spectrum, but every child should visit a dentist after their first birthday. Now, let me explain to you why. There are multiple reasons. First of all, you will get educated by the dentist, what you need to do, what you don't need to do. Second, your child is young. So as he grows up, you're going every 6 months. This becomes a routine. This is not a scary process. He's already used to it during his growing years. Third of all, if there is something wrong, early detection, right? We don't have to do aggressive treatment. Something is wrong, they can fix it when it's small. To me, the most important reason to take your child, especially if he's on spectrum, early is, let's say you haven't taken your child to a dentist for 4 or 5 years, and now his tooth is hurting. Obviously, there is something wrong. So now you are going to take a child. He's going to need treatment, whether it's first, he has never been. Second, the treatment is more aggressive, a new environment, new people. And now, instead of just getting a cleaning exam, he will get treatment. So it becomes like a scary process. The first experience becomes is not pleasant. Put it that way. It will remain in their mind.
Yeah.
Versus if you have routinely taken them, they've had cleaning, they know the dentist, oh, I know this place, they're going to take x-rays. Oh, I know this place, they're going to brush my teeth. Oh, she's going to count my teeth. Versus you're 4 or 5 years old, you're going to the dentist, now they're taking pictures. It's a whole new experience. And then you have cavities and they're going to fix it. So please make it a routine. First birthday, it's simple. They do a visual exam, brush their teeth, done, 5 minutes. And now Medi-Cal, what it's doing is, before it would allow kids to be seen every 6 months. But if they are under 3, every 3 months. So you can go every 3 months.
Wow.
Okay. And if they are up to 6 years old and they are getting cavities, then also, again, they're high risk. They can go every 3 months. But for me, if I have a patient on spectrum, whether Medi-Cal covers it or not, I always tell them, instead of 6 months, bring him every 3 months. I'll just have a look. That way he won't forget me. That way it won't be a new scary experience. So
love it. Miss Brenda is also saying, forgive me 1 second. Miss Brenda has written in and said, yes, she definitely agrees with you starting at an early age. And we want to thank Giggle Pickles, who has shared us on their Facebook. Thank you, Giggle Pickles. Sorry for interrupting you, Dr. Shaw.
No, not at all. I'm enjoying this, actually. And then another important thing is, parents often ask me about the sensory issues. They're having a tough time brushing their teeth. So here's what I want you to do. Start early. We already discussed that. And then start introducing sensory touches. So first start with back of the head, press for 2-3 seconds. Start early, 2-3 seconds, couple of times a day. They will get used to it. Next, move on to the side, move on to the face, cheeks. So they'll get comfortable with you touching them. Next, get a wet cloth. Introduce the wet cloth on there. You're doing it slowly. You're not just jumping and going in there. You don't want to scare them. Get a wet cloth, introduce it to the cheek, then slowly introduce it to their teeth. They'll get used to the wet cloth. So start early. See, this is why I want you to start early. And then once they are comfortable with the wet cloth, get a soft toothbrush. Introduce it without toothpaste. Okay, just so you're not, take it slow. Take it slow. So now you've introduced a soft toothbrush. Just brush slowly. They're young. They will get used to it. Next, introduce the toothpaste. I always say, first introduce the toothpaste that has no taste, So you're actually increasing their sensory stimulation slowly, and this will help you brush their teeth. Okay. Also, don't get discouraged. It's not only the kids in spectrum that fight brushing. Every child fights brushing. You fight back. If it makes you feel any better, I used to sit on my son till he was 2 years old. He didn't like it. And my husband, honestly, so many times he said, are you brushing or what are you doing? I said, I'd rather brush than he get cavities. Yeah. But so don't feel bad that it's your child. Most of the children will fight, but you keep doing it until they know that this is a part of a routine life. And then I know after 2.5, I read the book to my son, I showed him videos, and then it was all easy.
Well, and we know that social stories is something that helps ease the anxiety that our kiddos are having, and it helps give a format for parents so that their anxiety, and caregivers, that their anxiety is eased as well. So you've got these books, and we mentioned before, but is there a place where they can go right now to look at Sam and the Sugar Bug? And you've got several books now.
I do. Sam and the Sugar Bug is the one that will help your child understand the need to brushing your teeth, and also kind of give them an idea of what happens during treatment. If your child doesn't like reading physical books, is interested in more, it catches their attention to watch, then I would recommend iBooks, Sam and the Sugar Bug. Because remember, Shannon, you've seen that, the one with with the music. So that's the one I recommend. But if your kid likes hard copy, then I would get No Rushing When Brushing. It has 2 books in it. It's also in Spanish. I got a lot of requests from teachers to translate it. So it's Cepilate los dientes con calma. I'm going to send you the links, but those are hardcover. So you have to choose. If your child is more into audio, then go to iBooks and download Sam and the Sugar Bug. If you want to read over and over again and show them visually the pictures from the book, then go and, on Amazon, and No Rushing When Brushing has both Sam and the Sugar Bug and Layla's First Visit to the Dentist. I forgot to tell you one thing. You were asking me how to get them. Another way I tell parents is when you go to the dentist, let's say you're going at an age of 3, you haven't been, like you said, take them for a tour first to a dental office. That day, don't do anything. Just show them, have them watch, talk to your dentist, say, I want to bring my child to a dentist, but I don't want to have him or her be scared. So I do that with a lot of my patients. I tell them, come, watch us. That way they become familiar. Also, like I said, read the books, Layla and the First Visit. I've done it page by page, what happens at the dentist. But don't just rely on the book. Have a tour of the office before you do that, so your child is familiar.
Yes. And somebody else is recommending as a fun activity, guardians and parents should brush teeth together at the same time. Our autistic children will watch and mimic what we do. I love that.
Yeah. And Sesame Street has a really nice video of such a musical one about brush your teeth. I wish I could let me see if I can pull up before the show ends, and I'll send them the link, because it shows families brushing together. Like I said, you can play that song, dance with them, and brush together with them to make it.
We'll Google that. I want to ask you more questions. I'd rather have your attention, because I want to know, now that we've talked about brushing, and in the beginning, we're not going to do the toothpaste, but eventually we're going to get to the toothpaste. So I think a big question on a lot of parents' mind, fluoride, no fluoride. What do you say?
So here's what I say. Up to the time, this is off of my experience, nothing, not written in books, documented, but what I have been doing for 20 years. I always tell my patients, use safe to swallow till they are 1 year old. It's called a training toothpaste. Okay. Fluoride is good for your children's teeth. It helps prevent cavities, and all the companies put only that amount of fluoride on toothpaste that is safe. So if you're using fluoridated toothpaste, no harm will be done. Remember that. But from 1 to 3, I want you to use just a smear layer, not like a whole squirt. So smear layer of children's fluoridated toothpaste, very little. And after 3, it would be pea size. Now, they may not like the taste of the fluoride toothpaste, so don't stop brushing because of that. For me, brushing is more important. Yes, you need fluoride, that helps, but if that is keeping your child from brushing because of the taste, brush their teeth, even with water, because your kids are in spectrum. But preferably, fluoride will prevent cavities, but use it in limit, only smear layer till they are 3 and pea size after 3. But
I think a lot of people are using way too much toothpaste.
Yes, so that's what that was important.
Not much.
Yeah, so that was important. So safe to swallow. This is my personal, experience, and what I've learned is it's better to use safe to swallow because they're going to eat it. After 1, if you use smear layer of fluoridated toothpaste till they are 3 years old, you're fine. At 3, use pea size. But if for some reason, because the kid is on spectrum, doesn't like toothpaste, don't stop.
Better to brush with water than
anything is better than no brushing. Remember that.
Okay, good. Now let's talk a little bit about what sedation, because we bring the kiddo to the dentist, and there are lots of discussion about this among parents about, especially when kiddos are on the spectrum, it may be easier to do the gas, but sometimes they don't react well to it. What is your thought on what's safe and what we should use for sedation?
I'm going to explain to you the way I explain to my patients in a very simple manner. When they're doing exams, cleaning, nothing is needed. They're already used to it. But when they need treatment, there are three kinds generally all offices follow. One is nitrous oxide. It's the gas we were talking about. Think of nitrous oxide, as a simple relaxant. You breathe it in, it relaxes you a little, but you're aware of everything that's going around you. So some kids do well with that. Okay. Some kids, it works well, as in they breathe it, but if the child is crying and, really anxious, they may not breathe it. So then it's not going to work. So that's how you decide, is nitrous enough for the child? Usually the dentist will know. When I do my exam, I kind of know, okay, the nitrous will work on this child. And sometimes older kids, they breathe it in, they're calm, you talk to them. So those are the kids that are good candidates for just nitrous, and then they'll numb them and do the process. Now, not all kids are like that, right? Then there are kids that are more anxious and need a lot of work. For them, there's something called oral sedation. This is the next step. I'm kind of giving you step by step.
Yeah.
Oral sedation is a drink we give them. That doesn't put them to sleep. Kind of makes them a little woozy. Think of it as getting drunk. I'm sorry. I just want to make it easy for you guys to understand.
Yeah.
So when you're drunk, you're doing things, and when you wake up the next morning, you're not clearly remembering what happened. That's exactly kind of what oral sedation does. What it does is you're kind of woozy, some kids go crazy, they're crying. I can tell you from my experience, my niece went ballistic with oral sedation, to the point my cousin called me and said, what is going on with her? Because she was crying, she was, through the treatment. But once the medicine wore off, she didn't remember anything. Okay. So I told her, be calm, it is okay. Different people react differently. Some are calm, some start kicking, some start crying. But the point of sedation is not to not make them cry. It's because they're still awake. They're still, knowing things are happening. There's not much of the recollection of that. Okay. Kind of think of it that way. But some kids might fight it. It's like, one person needs one shot to get numb, some need two. But oral sedation is a drug we can only give so much, according to the weight. So if you fight it, you have fought it, then, you will remember it. Okay. So that, unfortunately, we only know once the treatment is rendered, how much effective sedation was. Then there are those parents that really want to go one step forward, or the child is older, he's on spectrum, sedation is not going to do much because of that dose. We put them out, okay? That means general anesthesia, especially if they need a lot of treatment. And also, I always tell the parents with spectrum, if he is going to have a traumatic experience, he or she will not want to come back. So that has to be taken, that decision has to be taken wisely. If you think your child is going to fight it and it's going to make it difficult for him or her to go to dentist next time, then I want you to choose general anesthesia, because they'll be out and they won't know all of that. This is all for treatment, when they need a lot of treatment.
I'm so happy to hear you say that, because we've been dealing the last couple of weeks. We have one parent who's been writing in who's going through a terrible time because her child did go to the dentist, was traumatized, and he is having a really hard time, and it's been weeks. He's still having a hard time and is terrified. And they didn't put him all the way out. I don't know which of the first two they used, but at one point they restrained him, and he remembers it. And
always, the thing is that if you're using oral sedation or nitrous or they will restrain, because the instruments are sharp. If you move your arm and leg, you can potentially hurt yourself. So most of the dental offices do restrain them just for that. If the child is moving too much, for example, my niece, she was going ballistic. So we cannot take that chance. We can cut their lip. So we do have to put them in the blanket. But again, we have to choose the right mode of sedation for them. So talk to your dentist and see which is now there are three types of things that can be used. So she or he can choose the right one for you. That's what another channel.
And they're all safe. They're all safe
as long as they are measured by body weight. So It has to be a dentist with a license who is doing it. It has to be the right amount of drug. Another important thing here is medical history. Does a child have any medical problem that will compromise him taking oral sedation? Does he need to be hospitalized because if he's getting general anesthesia? So these are the questions I want you to ask. So it is safe, yes, because we are measuring the right amount of drug. We're checking the medical history. Is it safe to be administered in a dental office? But again, if I see a patient has medical conditions and it can make it dangerous for a dent, then we send him to the hospital because they have all the better things to control the. But another thing, Shannon, I want to tell you is that the only problem that comes with general anesthesia is I think Medi-Cal doesn't cover it. So we are trying hard to push that. I've been fighting it. So if you can join the fight, that would be awesome.
Sure.
It will make it easy for kids to go and get it. Because the parents, they have to go from hospital to hospital. The wait is long for general anesthesia. I need an advocate for that. I've been advocating.
All right, sign me up. Sign me up for that. I'm willing to help with that. But I also want to say, though, that it sounds like from all accounts here that the earlier we start going to the dentist before there's a problem, because it isn't just about the child understanding how the office works. I think that if a parent or a caregiver is there and gets to meet the dentist when it isn't urgent, then you guys together can have the conversation about what you think for the sedation. And it's
all about starting early. It's all about starting early. And hopefully when you're going to dentist from 1 year, they won't get to the situation where it gets so bad.
Yes. So it's one of those things to do early.
There is something very important I want to tell your audience about.
Yes.
I always advocate for that. Nursing bottle syndrome. Did you see the pictures?
Yes.
Do you think you can?
I can't bear to look. But talk to us a little bit about what nursing bottle syndrome is.
Yes, this is a very important information that I want all you parents to know. And if you hear it, I want you to share it. Because these are cavities that affect kids as young as 2. And the cavities are not what you see normally, like one here. It's heartbreaking. It eats away all their teeth. So I have seen kids that have got those cavities that are 2 years where I had to remove the teeth, or have you seen kids with silver teeth? So those are the teeth we have to clean, put medicine, put crowns on them. So this is what I want you to avoid. So what causes nursing bottle syndrome? 1, after first birthday. So feeding at night, let's start with feeding at night. You're feeding your child multiple times at night. They fall asleep while you're feeding. They do not swallow the last part of the milk. Remember that. Most of the kids. So that milk soaks their teeth for hours and it rots their teeth. Okay, so by the time they're 2, it's really bad. It breaks my heart. So here's what I want you to do. Whether you're breastfeeding or giving the child the bottle after first birthday when the teeth have come in. I'm not against breastfeeding. Please don't get me on that. Breastfeeding is great. We're just talking about at night feeding or nap when they nap. So what happens, like I said, they don't swallow the last part. So after first birthday, I want you to get into habit of reducing the feeding at night. Give them a good dinner, brush their teeth, go to bed. I'm a mother too, doesn't happen overnight. So, these are things we all talk about, but are not that easy. So try your best, slowly reduce the number. But until you achieve that, what I would recommend is when you go to bed, take a bottle filled with water, whether you're breastfeeding or you're giving the child bottle at night. Once you're done feeding, I can't ask you to brush their teeth every time, right? That's too much. I'm a mother too. You're already exhausted. Stick that water bottle in their mouth. They'll suck on it and it'll wash the leftover milk away. Whether they are napping or you're feeding them multiple times at night. And I'm pretty sure you do that, it will greatly reduce the incidence of those cavities. And eventually, you will also wean them off at the right age from night feeding. So after first birthday, Try to reduce feeding at night, and until you achieve that, keep a bottle by your side filled with water. Stick the water bottle in their mouth in the end to wash that leftover milk away.
That's
Second,
brilliant. Yeah, go ahead.
second reason for getting nursing bottle syndrome that has become very popular right now is juice. Because they commercialize it so much that parents feel like, oh my God, this must be the best thing for my child. Keep in mind, juice is just sugar, water, and acid. Do not replace it with water. Many countries do not give juice to kids till they are 2 or 3 because of the same reason. Do not give more than 4 ounces a day juice to a child. And that to only one meal if you really want to do it. I would say avoid it altogether. Water, juice is no alternative to water. Now I see patients coming to me with bottle filled of juice. I go to park, sippy cups are filled with juice. Whether it is diluted or regular juice, it's enough for your kids to get those ugly silver teeth, which we don't want them to get. And if we can avoid them, why not? So give them water. And like I said, if you really want to give them juice, 1 time a day, 4 ounces. Feed them every 2 hours. And also another thing is snacking. Don't keep the snacks out where a child would go eat, because there'll be a constant supply of sugar. I always tell my parents, breakfast, let's say at 8, snack at 10, lunch at 12, another snack, dinner. That way you have some period, where there's not a constant supply of sugar to your teeth. So make a routine. Everything should be a routine versus there are crackers outside, he's chewing on one, then because they stick to the teeth. And that's another reason.
Okay, that is great advice.
That's very close to my heart, Shannon. I'm so sorry. I had to say this.
No. I'm glad because, sometimes we are so busy up our own autism tree that this is an area where we don't get things taken care of, and it can end up being a really bad situation for our kiddos. So I think it's really important that we get this information and get it out to the autism community. I also want to say, there are other ramifications for the juice as well. We know that we have seen our kids when they have a certain level of sugar intake, that we get more behaviors. And that some of the juices have artificial colors and we get more behaviors. And unless you're doing 100% pure organic, you're also getting a pesticide, which also increases behavior. And we're not even talking about how the prevalence of diabetes in kids these days. In the United States, it's off the charts. It isn't that way in other countries because we are giving so much juice. So for all of those reasons, juice is not a good idea. So I appreciate you talking about that. So, and Traven, she just put the link in our private comments for the book.
I put the link.
But I want you to hold the book up again. I'm sorry?
Yes, I want to send you these links. The link I sent you, Shannon, is the one for the kids with special needs.
Okay, but I want you to hold the book up again because I think the easiest thing is that people are going to go to Amazon or go to iBooks. But I want you to hold the book up for us again because it's beautiful. I want people to see what a beautiful book it is. And you can be reading this with your small children or have them read it and you sit with them and talk about it. But we know that that kind of learning is, move it just a little bit over that way, the other way. Yeah, it's weird. So no rushing when brushing. Go to Amazon. You can get that today.
Yeah,
or if you want, go ahead and show, because they're beautiful illustrations.
Look at that. Sam and the sugar.
Yeah, there we go.
Encourage them to brush their teeth. And the second one in that, so it's a pack of 2 books that I wanted parents to have. So they have everything they need. It has the second book in it is Layla Visits the Dentist. So that way you can read, but remember also reading, I would recommend after you read the book, you take them for a tour to dental office to make it easy for you.
Absolutely. And not only will it make it easier for them, it also helps the caregiver. Now you have a working relationship with the people in the dentist's office, which is the thing you need. Please don't wait until there's an emergency because then everything's rushed and you will feel like, Dr. Shaw, for people who are in, what area would people have to be in to have you as their dentist?
I really go to different dentists, offices. So it's not just me. You can go to any dentist, but as long as it's a children's dentist, that's my point.
Okay.
Children's
All right.
dentist. So
Yes, but we all want to go to you now.
the basic thing is that I only do the exams. I don't do the treatment. So I don't want them to be disappointed that when they come, I just do exam, education for the patients. So I don't want
Well,
them.
that's a lovely thing. That is a lovely thing.
So
But Dr. Shaw, we're out of time, unfortunately.
I
But
know,
I
but
appreciate
remember,
you.
Shannon, I want you to encourage them to go to a children's dentist, not a general dentist. They would not know what to do.
Yeah, you guys, you got to go to a pediatric dentist and visit first. Not only will it, and maybe you need to visit more than one. You know, you walk into an office and you feel if the dentist is going to be good with your kiddo on the spectrum and the people in the office are going to be good. And if they're going to let you do the tour, if they're not letting you do that, that's not the dentist for you right now. So, but we need to be listening to the good doctor, and please get her book and read the book with your child. We need to normalize as much as possible good dental habits with our kiddos. Otherwise, it comes back to haunt us later on. So, Dr. Shaw, thank you so much for being with us. I'm sorry that we had so many technical problems, but we so appreciate it. And everybody who's writing in.
I was so worried because they're going to do a power cut in my area.
Right.
So I'm using my phone because I was like, I don't want to be disconnected. So I was using my phone. So
well, it's worked really well. But Dr. Shaw, thank you so much. I'm past time now, so I got to say goodbye. But thank you so much for being with us. Want to remind everybody, thank you. Tomorrow, Let's Talk Autism with Shannon and Nancy. Nancy Alspaugh-Jackson will be here with me, along with Kurt Manichek. He's back, and we're going to be talking about his program, the Teen Smile and Succeed program. He's got a social skills program that helps teach pre-employment and customer service skills to teens. It's really good social skills stuff, and there's a new program that's online. So I know you guys are going to be very interested in that. Plus, we'll have in the news. That's tomorrow. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now. Thanks for watching Autism Live. If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and on Instagram for important updates. And please download our free podcast wherever you get your podcasts. Thank you so much. See you next time.